Out again.
Okay.
Morning, good evening. This is the USMLE Sarthi team, and today's webinar is about electives and externships. So we'll talk about where you can apply for these electives, what are the documents that are needed, and of course, if you are doing the rotations or externships, then when should you apply? So with that said, let me introduce our team. Dr. Revanth is there with us, and he's going to talk about the electives process because he has gone through it himself as well. So welcome, Revanth.
Hello, sir. Welcome, everyone.
So let's first talk about, the Corona pandemic had stopped these rotations and electives. So what is your experience and when do you think they are going to resume these electives? Which universities have already resumed it?
Hello, everyone. So I personally applied to a lot of programs. I even mailed the programs which are not yet open. So right now, only three of the universities are open. One is University of Illinois, the other is University of Alabama, and the third one is University of North Carolina, and fourth one is FIU, Florida International University. Other than these universities, none of the other universities are open, and most of the universities might take their decision in the March of 2022.
Okay. So for those applicants, students who are applying for March or later, they should be in good shape, assuming the Corona pandemic is under control. And now, of course, the flights, they have resumed as well. Okay, so that's good to know. Now let's talk about the paperwork that is needed. What all documents are needed to apply to these university electives or clerkships?
Yeah, so the paperwork that's actually common for both the clerkships which requires step one and which doesn't require step one. It is only that the step one score report that is required for step one requiring electives. Other than the step one score report, we need to have Toefl score report and an immunization forms. We need to have a various immunization forms. It is mumps, measles, rubella, varicella, hepatitis B, polio, and also Montax test. These are the required documents. Other than these, universities will ask for separate documents. For example, most of the universities even ask for a 10 drug screening panel test as well. So even that is something which is important. And after the immunization documents, you need to also present them with a health insurance plan. You can take it from India, or else you can you can go for a HDFC, Go, or something like that. There are a lot of health insurance plans, and you need to take a malpractice insurance plans. So some universities ask us to take the malpractice insurance right even before we are accepted or not. But some universities will let us know to take the malpractice insurance after we got accepted. So that is one thing which we need to work out. And the next one is a dean's letter. So dean's letter is something which your college should provide, and then it's different for different colleges. But there are three common points which should be included in dean's letter, no matter which college are you from. The number one is your date of graduation, that you will be graduating in so and so date. Number two is the dean should also certify that you are done with the basic rotation, that is internal medicine, surgery, pediatrics, family medicine, obs-gynae, psychiatry, and neurology. These should be mentioned. Yeah. So these are the requirement for the AAMC. So these should be done for a person to do for a student to do a rotations in the United States. So this should be verified in the dean's letter. And third thing is the dean should also mention the modem of teaching in your medical school. If the medium of teaching in your medical school is English, you should mention that the medium of teaching, the MBBS or the MD in your medical school is English. That is very important because some universities give us a waiver if the modem of teaching in our medical school is English, and University of Illinois is one among them. And seventh one and the last document, and the next document is transcript. Again, the transcript is different for different medical colleges and universities, and you need to speak with your coordinators in your medical school. So, and the last document is an English waiver document. So you should also mention, like how I said, it should be mentioned in the dean's letter. We should also take a different document stating that the medium of language in the practical medical school is English. So these documents sometimes helps you with the waiver of TOEFL. So these are something which are very important documents that you need to be ready with.
Okay, so I am getting a question here. One of our audience, Vasavi, is asking: is TOEFL compulsory, or can we get a waiver, especially if you have taken OET? So I don't know if you will know about OET, but can TOEFL be waived?
So I personally mailed some colleges that if I take an OET, will they give me a waiver? None of the universities accepted that. They simply asked me to take the TOEFL, and
Okay.
yeah, 90% of the universities require TOEFL no matter what, and 10% which doesn't require TOEFL can be applied, but of course it's very competitive compared. But TOEFL is absolutely required, and the TOEFL score should be more than 100 with 25 in each. That's something which makes you in a safer side.
Okay. Okay. I'm going to read the questions as we get them. So next question comes from Aman. He says, my college is not VSLO registered. Will this hamper my chances of being selected for an elective?
Yeah, so I can definitely say that VSLO is something important, but there are only 8 medical colleges in India that have a VSLO agreement. So there are a lot of universities which actually offer the clerkships without VSLO. You can definitely apply to them. But of course, I agree that VSLO increase your chances, but without VSLO, I don't think your chances will decrease. So you can apply to the universities which does not require VSLO. For example, I personally got accepted in University of Alabama and University of Illinois. My college is not into VSLO, but I applied. So you can get into universities which doesn't require a VSLO.
Right, right. And also here, I want to point out that we do have electives and externships for both the graduates and if you're a student, and I've just posted the link there. So our partner sites also can help you with the electives if you need, and if you're not able to get due to lack of time or anything directly, you cannot get into the university. So we have over 100 locations and they don't need TOEFL. So that's something if you guys are interested and are looking to explore. Okay, so now let's go to the next question, which is how far in advance should the students apply for electives and clerkships?
I think this is a right question because not all the university. So this timeline varies from university to university. Most of the universities, for most of the universities, you need to apply more than 6 months in advance. But there are some universities like the University of Alabama and University of Illinois. You need to apply at least 10 months in advance or at least 12 months for University of Alabama. So rather than saying like how many months in advance to apply, I think we need to be specific about when the university opens up to accept applications. So University of Alabama usually opens up for application in the month of April or May, and University of North Carolina opens up every 6 months. So and John Hopkins opens up every 6 months. Yale opens up every 6 months. So usually the ideal time is more than 6 months, but again, I want to say it varies from university to universities. And the earlier you apply, the chances will be more to get that rotation. So yeah.
Okay, and just again to help our audience, Revant has put together a complete list of these university electives and programs, which will be our next video in the coming days, where we have identified all these programs where you can apply. So we'll talk about that later in a few minutes. But the next question I'm getting, Revant, is from Sanjay. He's asking, how can I get a research elective? What is the process? Now, did you apply to a research elective at all?
Yes, sir. Actually, I looked at the research elective that's in John Hopkins. It's a research elective. So I even inquired, I even spoke with few people who got accepted there. So there is only one research elective that is available for IMGs, that is a John Hopkins. And for us to get a John Hopkins elective, we need to contact the professor. So if you apply the traditional way, it is highly impossible. Most of the applications get rejected.
I see.
For that, you need to specifically contact the department and more specifically contact the professor first. So mail him requesting that you're interested in so and so research. And once he said, go ahead, then go fill the application and apply for the John Hopkins Elective. So that is how John Hopkins Elective works. Even though it just looks like it just looks like an application. Even if we drop an application, it doesn't work. So I personally saw a lot of people. Yeah, that is how you apply for a John Hopkins Research Elective.
Okay. And what about the visa? So assuming, once this corona pandemic goes away and embassies are open again, so is this the B1, B2 visa, or what visa do you get when you're applying for electives?
Yeah, so here for electives, it is mostly B1, B2 visa itself, but except for one elective, that is University of Texas Southwestern.
Okay.
If you're applying for UT Southwestern elective in urology, you need to apply for a F1 visa. That is the
Oh.
only exception. Other than that, all the universities accept you based on the B1, B2 visa itself. And coming to the visa issues, I agree that pandemic has delayed a lot of visas. Like there are a lot of people who are waiting for their visas, but starting from November 8th, the visas are opened in India at least. So right now the visa B1, B2 stamping is going on. So you can apply for that. And of course, to apply for a B1, B2 visa, when you go to an interview, you need to even produce the acceptance letter as well.
Okay. Okay. All right. So I guess the next question is about the universities that take without step one and some electives that require step one. And like I said, we will publish the next video where we'll have a complete list. But can you just give us 4 or 5 that allow you an elective without step one?
Yes, sir, definitely. So without step one, you can apply for University of Illinois, University of Alabama, Weill Cornell University, and also FIU doesn't require any step one, Florida International University. And the universities which require step one includes Kaiser Permanente, that requires step one, and that only accepts students for into internal medicine, Santa Clara. And University of North Carolina requires step one. So these are some universities which require step one and doesn't require step one.
Okay.
And even Harvard and Stanford doesn't require step one. You can apply to those as
well. Okay. I guess Akash is asking a question, and I have a similar question. How hard is it to get an elective? And then, of course, electives are, as the name suggests, they are electives, whereas clerkships are in the core specialty. So most IMGs go for electives, right? So what is how hard it is to get an elective, and how does it compare to getting a clerkship?
I think it is definitely competitive to get an elective or clerkship, because what happens with these universities is they only accept one international student per department for 1 month. So for example, I got accepted in University of Alabama for pediatric infectious disease in the month of June. So pediatric infectious disease accepts only one student for 1 month, or whatever department it is, they accept only one international student for 1 month. So that is definitely competitive. But again, if you apply like 8 months or 10 months before, and if you apply with all the documents without any errors in the documents, you definitely have a good chance to get a rotation. It is subjective to university to be more specific.
Okay. Okay. So as we get more questions in the chat, also tell our audience, and maybe I can also talk about it, the importance of electives. How important are electives as part of your USMLE math journey?
Electives is actually a requirement to apply for a lot of programs. You need to have at least 3 months of USCE to apply. And of course, an elective is much more preferred than an observership. But again, it's not everyone get the elective. So electives are extremely important, and electives give us a letter of recommendation. So we need to have American letter of recommendation. And right now, then since the CS is also cancelled, and also step one is turning into pass or fail, I personally believe that electives would play a major role in the coming matches.
And you're right. I mean, electives are very powerful if you are an IMG. Electives are much better than externships. So if you can do the electives, go for it, because they give you the experience in direct patient management, and you work with the American graduates, you work with the residents in that program. So definitely electives and the LORs of the electives are very, very impactful when it comes to the match season. Okay, so Dipinder is asking, can you suggest some electives with short waiting period? So I guess, are there electives where, the wait time is not 6 months, 9 months?
I'm sorry that there is no elective which is less than 6 months. All the electives required, like you need to at least apply them in advance for more than 6 months. So there are no such electives. Of course, if you can contact like these we have electives, so you can
Yes.
apply there. There you can apply within 6 months. So
Yeah, so if someone is looking for immediate electives and you're not able to get into directly the universities, we have our link that I will post. You can check our list of rotations, both electives and externships. So we do both, whether you're a graduate or a student, that can help you. So I guess the other question, important one that Sanjay is asking, what is a good time to go for electives? Should I do it in the third year, or when do you recommend? Because if you do it in third year, math will be in 3 more years from then. So what do you recommend is a good time to do the electives?
So I'd say it is better to do in the last 6 months of your internship, not even the first 6 months. I'd say in the last 6 months. The reason for that is, so in the last 6 months of internship, when you do your elective, when you apply for the match the next year, your electives will be fresh. Like your letter of recommendation will have a newer date on it, and it's much preferable to do in the last 6 months. And also, these electives require something as a requirement that you need to do your rotations in the basic departments. And third year is not the right time to apply for electives. And by third year, the people will like we students in India will not be ready with all the core clerkships. So we need to only apply after the fourth year. So
Okay, good. So I'll take the next couple of questions. Shruti is asking, how is externship different? So externship is done after you have graduated. So there are a lot of students, A, who could not do electives, and B, even if they did electives, now they have graduated. So in order to fill the CV and show that you're clinically current, you do externships. The point here is, if you can do electives, go for electives. However, if you've already graduated or you cannot do electives, then go for externships. These are also, at least with our partner sites, are hands-on. They are better than just observerships. So go for externships if you cannot do the electives. The next question that I can take is, what are the minimum months we should do for electives? And I think if you can do 3 months, that is ideal. You get 3 LORs, and minimum 3 LORs are US LORs are expected as you apply for the match. So if you can do 3 months of USCE in electives, that will help you. Okay. So next question that we are seeing, Revant, Dora is asking, does studying in small college matter for, I guess, elective application?
not really. So no matter what your college is, you can apply, and the university doesn't judge you based on your college for electives. So that's never an issue. It's just that you need to apply and you need to get the required documents from your university, and it's just that you need to apply in the right time and to the right university.
Okay, good. Next question comes from Aniket. What is the best approach for people who have graduated? So Aniket, as I was mentioning, the best approach will be for you to do externships. If you have graduated, these should be done in a hands-on capacity. They can be inpatient, they can be outpatient with affiliated clinics. As long as you can demonstrate strong clinical work experience, you will get an excellent LOR on the university or hospital letterhead. So you can check our website that I've just posted below, and you can go from there. So next question is from Ishan, which I think a lot of students ask, which is, do you need to extend externship in India if you want to do electives?
Extend what, sir? Internship?
The internship, yep.
Uh, I think maybe extending for 6 months is fine, but more than that, it's subjected to your specific university if they allow it or not. But 6 months is fine. You can wait for 6 months and you can go rotate there. That is totally fine. But more than that, you need to check that with your specific university. But
Yeah.
outside is worth it. But
No, you're right. Most Indian students that we have seen, they do take an extension for their electives. Like I said, if you can do 3 to 4 months electives, that's good. Up to 6 months, you are fine. More than 6 months, the gaps tend to come in your CV. Okay. Now, next question, and Pratiksha is asking, and maybe this will be in our list. Can you suggest some universities for family medicine electives? I don't know if you looked at specifically family medicine.
specifically family med, actually for family medicine, there are very little amount, like very few electives. If you want to do a family medicine elective, you can try it Will Cornell. It's not opened yet, but Will Cornell, as far as I remember, that has a family medicine elective. And you can also try at University of North Carolina, UNC, but UNC requires a step one for you to apply. So these are two universities which I personally know. And also you can look at the Kansas University Medical Center, KUMC, even that has a family medicine elective.
Okay. Deepthi is asking, I am preparing for step one right now. When should I apply for externship? So the question here, if you're applying for externship and you've already graduated, focus on step one. I think that is going to be important, especially it also depends when you're taking step one, whether it's pass fail or for score. So if you're taking it for score before January 26, 22, then I think scores are important. So focus on that, and then you can apply for externship if it is for next season. Vasavi is asking, how long does an externship last? So typically, whether it's externship or elective, there are generally 4 weeks each. So try to do at least 3 electives or externship 4 weeks each, so about 3 months. What are the options for a graduate? As I mentioned, Rust, these are called externships. You can check our website for those. Manvi is asking, what is the difference between electives we apply and electives that can be applied through consultancies like USMLE Sarthi? So there are several differences. Many universities only allow direct applications. So, if you are getting a direct university elective, you should go for it, right? There is absolutely no doubt about it. But there are times when you cannot get it, when there is a long wait time, and then, or you want externships, then we can help you. You can check our website. I can take the next question, which Aniket is asking. Is taking up a research position worth it? How can we get research position or apply for the same? So Aniket, taking up research position, I'm assuming you are asking not the research elective. So these are full-time research positions in the US, typically on J1 visa for graduates. Is it worth it? Yes, if you can get a good research position at, say, there are many programs, Cleveland Clinic, Hopkins, Mayo Clinic. If you have done enough hands-on, whether it is electives or externships, these positions can be very, very useful. How can you look for them? You can apply directly. Now, of course, we also have research courses. In fact, our research course, the next batch just started today, which can also lead to publication. So, but if you're looking for direct full-time research courses or research positions, you have to apply directly. Then the next question are there some places like IMG friendly electives places? Revant, IMG friendly electives.
Yeah, so most of the electives are IMG friendly itself, except for a few places like University of Illinois. So University of Illinois is also IMG friendly, but what they do is they accept the students from their affiliates first. So for example, my medical college has an affiliation. with University of Illinois, and if another person's college doesn't have any affiliation, and if you both apply on the same time, they would offer me an elective, and after filling me, if there is any vacancies of his options, then they'll fill him. So that is how University of Illinois works. But other than University of Illinois, most of the rotations are IMG friendly. They are open for IMGs especially.
Okay. Next two questions I can take: how to find externships. So, again, externship, Taisir, you can either look our website or there are others you can get into externship. Just compare the pricing. That's something that you should all compare. How difficult it is to get externship, Akash is asking. I think this is at this point of the season, November, December, January, it's actually ideal. You should start if you are looking for externship now, because when you come to July, August, September, a lot of people will start externships and will be peak time. So your experience will be with a lot of students. So if you can do externship now, that'll be good. Sanjay is asking, does USMLE Sarthi provide help in getting a research electives? No, we have our own research course that you can take, but not the research elective. We are trying to set some research electives, but at this point, we have only clinical electives and externship. So Vishwa is asking, Revant, maybe you can answer. My externship gets over in March. What would you suggest? When should I go for electives and take step 1?
So if you're already done, if you're doing externship, that means you're already a graduate student. So you can't go for a clerkship or elective. And regarding the taking of step 1, I would always say as soon as possible after externship. As soon as possible. Since it will be pass or fail in the March, so I think you need to go for a step 1 as soon as possible.
Okay. Then there is a question: people going for surgery residency and planning on doing a research year should we apply for electives? And are LORs from research fellowships as valuable or more valuable? So definitely, even if you are going for research or surgery, electives are very useful. Electives are done as a student. So if you're planning a research year, that has to come after the electives, and yes, they are very useful. Then the next question is, telerotations did not work this year for me. What might be the reason? So Kaval, telerotations, of course, last season and to some extent this season did work. It depends on the type of telerotation. Some telerotations do give you a lot of patient exposure, patient management. You end up seeing 10 to 15 patients a day over Zoom or other video technology, and you get to use the EMR system. So telerotation are also of different kinds. You can have didactic based or patient interaction telerotations. But as more and more electives and externships are opening up, I think if you focus on-site, that may be a good idea. You can still do tele once in a while, but if you have all telerotations, that may not help, right? So 3 or 4 months of telerotations only without on-site USCE may not be that helpful. Okay, so then second, I'm just reading the question. So Sanjay is asking, research elective through Hopkins, is that the only option? Well, I think NIH used to do a research electives, and he's saying some agencies do provide research electives through them. So I'm not sure how the agencies can provide you research electives, because electives, research electives are meant to be with the faculty in that program. So I'm not sure how they are providing research electives. So if they are, make your due diligence, because you don't want to pay them 3,000 and 4,000 and then figure out that these are not research electives. So, you should check with those agencies. Like I said, we don't provide research electives. Dipinder is asking paperwork required for electives. Dipinder, we just covered it in the beginning. There's a list of 7 documents for electives. For externships, of course, if you go through us, we have you fill up the form. It's a very simple form, but our team can get in touch with you if you are interested. It's not that big a deal in terms of paperwork. We don't need Toefl. Some of our sites do not need step 1 also. Okay. Revan, do you know any universities for neurosurgery or ortho electives, orthopedic?
University of Illinois, which offers an excellent neurosurgery elective. And for orthopedics in specific, orthopedics has a very few number of electives. Harvard offers an orthopedic elective.
Okay.
But Harvard is right now closed. So
I see. Where can we apply for OBGYN? So, so in terms of USC, of course, there are some externships on our website, also some electives you can look at it. But if you are trying to apply directly for the universities, Revan, did you know about the OBGYN?
OBGYN, most of the university rotations like offer OBGYN. So university rotations mostly offer internal medicine, pediatrics, general surgery, OBGYN, and family medicine. And super specialties include nephrology, gastroenterology. So neurosurgery and orthopedics and OB are like subjective. Some offer and do not offer, but OBGYN is offered by most of the rotations, like most of the universities.
Okay. Okay. I can take the next question. Difference between research elective and research trainee. So research trainee is typically, if you have a full-time position, perhaps, then you could be called a research trainee, or some programs like to call you a research trainee even in an elective. So I think we'll have to look at the specific program to tell you in terms of the profile, what is the difference between the research elective and research training. Okay, so I think we are coming to an end to this webinar. If you have any other questions, we can take them now. But otherwise, we plan to do these very, very regularly. So, look up our previous webinar on research. And then in the coming weeks and months, we'll also have some attendings who offer electives, and we'll have more on these. Let me see if there are any other last minute questions. So Teja is asking, Revant, best score in Toefl for electives.
Yeah, it's more than 100 and 25 in each section, 25 in reading, speaking, listening, and writing. That's the ideal score. Most of the except for Cleveland, most of the universities accept 25. Cleveland requires 26 in reading. So.
Okay. Kaval is asking, does our team at USMLE Sarthi provide observerships or hands-on in clinic or in hospital? We provide only hands-on, no observerships, so it's better for you. And it's a mix. It depends on the locations. Sometimes because of COVID, they may not allow hospital, but so it could be the outpatient clinic of the hospital itself, and some could be inpatient like in Chicago. So it will depend. You can look up our website and it'll list you where we provide. Then Deepthi is asking, are we paid in full-time research positions? It depends. Some places pay you if you are on J1, others do not pay you. So it all depends. Ramo Gaming is asking, is there a problem if LORs from the electives are old? So, try to get recent LORs, maybe 1 year old. If it's a 5-year-old LOR from electives, then it doesn't really matter. Okay, but if you're applying after a research year, as I think your plan is, then it should be fine. So Revant, any last minute advice you have as we wrap this up?
Yep. Yes, sir. So I have to say one thing, all that matters for a student to get elective is the timing. You need to apply for electives as soon as possible. and the second is the factor of luck that plays a major role. So these are the two things which plays a major role. And be ready with all the documents that I explained in the beginning of the video before applying there. So the moment the program coordinator asks for a document, you can just send the document straight away. In that way, the program coordinators will be happy and they can do a much better work for us. So.
Okay, I'll take, people are still asking questions. So Pratiksha, your question, when will the universities open up for electives? As Revant said, probably after March. So you should be ready. And Rust, so time taken to prepare for TOEFL. Revant, how much time generally for TOEFL?
I studied for TOEFL an hour a day for a week or more than a week. That's it. For TOEFL, what does matters is just get to know the exam pattern. That's it. And rest of the things. So for TOEFL, I think writing section is something which you need to concentrate. So writing is something you need someone to check your writing. Other than that, TOEFL doesn't require much time. All that TOEFL requires is your concentration and just maybe a week if you want to study dedicatedly. That's it.
Okay. All right. Last question before we wrap up. Rust is asking, is TOEFL required for externships? So the answer is no. If you're doing just an externship, most of our partners do not require TOEFL. Okay. Is step 2 CS cancelled permanently? So far, we think it is cancelled permanently. What is the substitute? We don't know yet. ECFMG comes out every year. So the past 2 years, they've been using OET. They are working on a permanent solution. We will know what it is, I think, by March or April, or they may just extend OET. But as we understand, step 2 CS has been cancelled. It may come back in some shape or form for now. All right, I think that was all that we had. Thank you very much, everyone. And you have a good rest of the weekend, and subscribe to our channel because we will do these webinars very regularly to help you in your USMLE journey.